Hello, hello. Welcome, 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 welcome. Hope everyone is doing great tonight. Some people are already here. That's awesome. Welcome. It is what is it? It's February 8th, Tuesday at 7:01 p.m. My name is Ethan. This is Community Conversations. As always, we like to give a couple minutes to let people get in and settled. So if you're just getting settled, please say hello. Let us know where you're from, and your name will come up where you're from, and let's see here. What did we do last time? We did pasta last time, which is I'm gonna do it again. I'm gonna test the audience because last time, favorite sushi roll. Last time, pretty much everybody hated sushi. So I'm curious, have we shifted in the last year since I asked this question? So, or I should say, favorite sushi. It doesn't have to be a roll, but favorite thing to get is sushi. Favorite type of ice cream sprinkles, Katie. It's any sprinkles. Hi, Leanne. I hope you're well. Yes. Hi, Mom. Good to see you. Shrimp tempura roll for sure. Is always delicious. Delicious. It's delicious. Kelly from Arizona. It's been a while. It's good to see you. I hope you. It has been a while. Um, let's see here. Okay. Hey, there's John. John, we'll need a picture of your hoodie soon. So we're coming up on 30 seconds. If you're just joining us, my name is Ethan. Welcome to Community Conversations, episode 3. Uh, let's see, what is episode 3 called? Revenge of the Sith. No, that's the crappy one. Return of the Jedi. Return of the Jedi. Anyway, get started in just a few minutes. If you're just joining us, let us know you're here, where you're from, and favorite sushi roll. Um, so hey, Mike, it's good to see you. Hi, Carol. Hey, Dave. Oh, Allison, proudly wearing my new IOCDF hoodie. That's awesome. I love that. All right, Leanne, thank you. You're down for sushi for sure, and the emoji. I already see some questions coming in. Let's get started. I will answer your questions, Senorita, and Will, if you're still on, I will also answer your questions. Let me just get through some brief housekeeping, and then we will jump right in. So, welcome, welcome. It's Tuesday evening. Beth Carducci's in the house. We love Beth. We love everyone. So thanks for joining. Yes, California rolls are delicious. Any roll that gets deep fried, absolutely. So you're a fan of the fair. Twinkies, Oreos, they had deep fried butter at the last fair I went to, which was really, really concerning. And it was also delicious. No kidding. I didn't try it. Anyway, my name is Ethan. I'm a national advocate for the International OCD Foundation, which simply means I have OCD and I won't stop talking about it. So, this community conversation is intended to serve as educational content and is not intended to replace therapy. For treatment related questions, please be sure to work with your local provider or contact a local clinician. The IOCDF is not a crisis hotline and should not be used if you're in distress or feel unsafe. If you are in a crisis or ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. We also always want to be respectful and kind to others, create a safe space as possible. This is obviously on the social media and is public and is being recorded so everyone can watch it after the fact. With that being said, though, even so, we like to create as safe and a supportive a space as possible. We are all here for each other, and that is what's most important. But just keep that in mind as you ask questions. And with that, welcome, welcome. Also, worth plugging, the Ethan 10 coupon is still up if you want to hit the IOCDF merch store for some hoodies or some shirts or some other cool merch. You can enter Ethan 10 in the coupon and get 10% off. I feel I'm worth more, but it was a committee decision, and clearly I didn't have that much pull. I hope everyone is doing really well tonight. In all sincerity, it's been 2 weeks, lots to catch up on. But as always, I have a story I want to tell about my own experience from a couple weekends ago, because I'm an open book. Ooh, Nagimaki, absolutely, Heather. I'm an open book, And so I'm going to share with you a rough weekend that I had. But at the same time, as always, I want to hear what's going on in your lives. And so please, please feel free to weigh in with questions, comments, topics. As you know, this conversation is about you and your community. You are the community. And so I look forward to talking. Quickly, though, let's jump to a super quick question at 7. Will ask, can COVID vaccines make our OCD worse? How concerned are people in the OCD support groups concerned with this? You know, I to my knowledge, it doesn't. I don't know that there's been any studies. I haven't seen it mentioned much in the support groups, if at all. Now, there's a lot of OCD around COVID, of course, and the concerns and fears around getting it and so forth, and how it's impacted the OCD community. And there can be fears and concerns about the vaccine itself, as far as making OCD worse. To my knowledge, there's no empirical evidence or scientific data to back that up. So I would say with some confidence, most confidence, no or not at this time. So I can tell you my experience. I am triple vaxxed, and my OCD has been okay. So has not made my OCD worse. Let's see. I know somebody else asked a quick question too. I want to jump to before I get into my story. Senorita at 7 to 4 p.m. asked, please, what's the duration for OCD recovery? I like this question. It's such a good question. So, recovery is a marathon, not a sprint. And it's so important to keep that in mind because it's, if you're just engaging in treatment for the first time and learning about OCD and learning about the treatment itself, it can take a while and you may feel worse before you feel better. And it's a process. And, somebody can come in extremely severe and get well really quick. And somebody that can have mild symptoms take longer. There's really no set time. It's individual for each person. And so, while I can't give you an exact time, I can tell you that the gold standard of treatment, which is exposure response prevention, along with other modalities of treatment like acceptance commitment therapy and dialectical behavioral therapy, are extremely effective treatments for OCD. And that's why I tell my story. I always believe if I can get better, everybody can get better. And I don't want my journey to be everyone else's journey. So I would have a lot of hope and be optimistic. The treatments in place are very effective and very good. Also, sometimes in combination with medication, if that's what your doctors feel. So, I would never, and it's hard to not be focused on how quick, because we all want to, get better as fast as possible. But OCD is one of those things. It reminds me of one of those pains that you pay attention to for a week, and then you suddenly realize that it's gone 2 weeks later, and you're like, oh yeah, I had that pain. And getting better from OCD is a lot like that. One day you're like, oh, I haven't had that thought in a while. I'm like, yeah, must be getting better. So, there's patience. It's the analogy that I always use is, it's like going to the gym. I want to go to the gym and I want to look like Mark Wahlberg. Can you do that in a night? No, it takes time and it takes effort and consistency and discipline. And but just like that, if you do that consistently, you don't have to be perfect, but if you do it consistently over time, you can achieve that. And it's the same with OCD treatment. Great question, Senorita. Nikki in the house, Dublin. Love Nikki. May I send you materials on this? Sure will. If you have materials, absolutely. I'm always open. I'll give out my email at the end. I think you actually may have it. You may have emailed me. I haven't gotten around to emails yet. But please feel free to send me materials on it. And let's see, Leanne asked a question at 7:09 p.m. And please, this is not about me. I have a story that I felt might be beneficial to let you know that, those of us that are up here talking, telling our stories, we do not have perfect days, weeks, or months. We wax and wane like all of you. So I was going to share a couple of weekends ago, I had one of the toughest times I've had in a few years. But please ask questions, topics, and I will keep answering them for sure. So let's see. At 7:09, Leanne asked, Ethan, tell me, please, is it acceptable for me to identify my OCD triggers like contamination OCD, or can only therapists identify the kinds of OCD one has? No, I think it's inside. I think it's okay to identify your OCD triggers. I think that we all have insight into our triggers and what triggers us. I would suggest, obviously, if you want a formal diagnosis and then obviously go to a clinician. But here's the thing, is that OCD is OCD is OCD. And I don't, some of us have heard us say that, some of us not. But what I mean by that is, OCD is treated the same no matter what the subtype or the trigger is, right? So it doesn't mean that it's not geared toward your specific symptom or subtype, but it's a kind of like a fill in the blank exposure response prevention. It's all ERP regardless. And if you have a fear of germs, or if you have a fear of hitting someone with your car or whatever, that particular trigger is plugged into the ERP formula, right? And they come up with exposures and response preventions depending on what you're dealing with to cater with that. Really using your symptoms and subtypes and triggers is a doorway into how ERP works. So it's important to recognize that ERP works for all symptoms and all subtypes. And I'm not saying that some are harder than others, and mental rituals are the same as physical rituals. And I'm not saying that more stigmatized subtypes and symptoms of OCD are easier to treat. They're not, because they're less talked about. So there's a lot more shame and guilt around pedophilia OCD or self-harm or or religious scrupulosity or things like that. But at the end of the day, I think having insight into your OCD is important, especially as you learn to manage it in a healthy way, especially with a therapist. So yeah, having insight into your triggers. You just don't want to get obsessive about identifying what your triggers are and making sure that you have them right. But there's nothing wrong with insight, and understanding that all of those insights can be applied. So especially as we know, therapy is unfortunately can be hard to access, whether it be location or because of price. And we're working really hard to change that. But if you're doing this on your own, if you're doing it through virtual, an app, or a really great book like Freedom from OCD, which is John Grayson's book, which I consider to be the OCD Bible, then it will require you to identify your own triggers and symptoms and subtypes. So yeah, definitely, Leanne. Totally okay. In my book, my own experience for sure. Oh, thank you, Leanne. Yes, everybody liked the stream. Oh, I love that. OCD is treated the same no matter what subtype of OCD you have. Thanks. Didn't know that. Oh, okay. You were commenting. Yeah. So, and let me specify, it's not a one size fits all approach. I'm not saying that, right? But if you imagine, if you have cancer, and sort of the go-to is chemotherapy, right? So, most cancer patients get chemotherapy. Now, within chemo, there's different levels, there's different amounts, there's different types depending on what. It's all chemotherapy, but there's nuances that are specific to you. And ERP is kind of the same way. There are nuances specific to you, but at the end of the day, ERP is exactly what it stands for. Exposure, expose yourself to your biggest fears. So if yours is contamination, becoming contaminated, whatever that means to you, Leanne. And then response prevention, which is not engaging in the compulsion. So not engaging in the thing that relieves your anxiety, sitting with the discomfort and the uncertainty that whatever happened, what you think may happen until you habituated, the anxiety starts to subside. And doing that in repetition over time starts to squelch the OCD, the thoughts, the feelings, and all that stuff. It's challenging to do. It's awesome that you're doing it on your own. I start OCD meetings tomorrow. Amazing. I'm so excited for you, Leanne. That's awesome. You should have all kinds of hope and optimism. But that's essentially it, right? So whether it's fear of vomiting, or it's fear of what if I accidentally kill my mother, or it's a fear of, like I said, hit and run OCD, right? It's exposing yourself to the fear, right? So what are ways we can get you triggered without actually doing some of these things, depending, we don't want you to actually kill your mother, but right, we may look at some movies or look at some images or whatever it is, and then have you sit with that anxiety and let that curve on its own. Listen, if compulsions didn't work, we wouldn't do them. So, it makes us feel better. And so that sort of ingrains the lesson in our head that, oh, if I keep doing these compulsions, that I start to feel better, and I'm going to keep doing them. The problem is they help less and less and less, and you keep doing them for longer and longer and longer until your entire life is eaten up by compulsions that aren't doing anything. Which is why living with the uncertainty and the discomfort is well worth it, because you do reach a place of management and maintenance, and life is really good and can be really good, even if there is no cure for OCD. And we're going to have a cure chronic conversation another time. That's a good topic for maybe a community conversation down the road. I'll just keep going because there's great questions here. Hello, Ethan. Continue. Thanks for all the time and support you give us. Love and best wishes from Liverpool. Thank you, Pauline. I appreciate that. Hi, Ethan. KLY. The past few times your manatee has really perplexed and oddly triggered me. Why is it there behind you? Is there an exposure for your OCD? Please forgive me for the strange question. Well, I mean, part of me doesn't want to answer because I kind of like that it's triggering, and maybe we should sit with the idea that we don't know what the manatee is there for, and we can just kind of deal with the uncertainty. Actually, though, one manatee is a beanie baby that is my girlfriend's. And it's one of those, those lists come out and they're like, this beanie baby is worth $10,000, and you're like, you look it up and you don't have it. That one actually is worth some insane amount of money. And then we've decided. See, you think forgive you for the strange question. Katie and I have decided that in our next life we're going to come back as manatee together. We have made this decision as a joint decision, and so for Christmas 2 years ago, she got me an adopt a manatee, and it came with a plush toy. So now you know. See, I got weird answers for your weird questions. Strange, I should say. Enrico, I hope I pronounced that right. ERP has been really effective for the last 2 months, but the last few days my OCD has been returning and exposures don't seem to be doing anything. Is this something to wait out? Great question. 7:13 p.m. So I'll again bring back the working out analogy. If you've ever tried to lose weight or work out, you hit a plateau, right? Where it seems impossible to lose the weight. You're doing all the things right. And it just is like, you're like, well, why am I not losing weight anymore? I'm doing all the right things. And then eventually, you either keep doing what you're doing or you change or modify something. It's very common in exposure response prevention therapy because you're moving up your hierarchy, right? And the easier things have gotten easier. And so as you move up, it gets harder and harder and more intense. And it may feel like, it's not working. We also tend to be really bad judges of whether ERP is effective or not. We may, in essence, feel like they're not doing anything when in fact we are still getting better because we feel a certain way, and feelings in regards to OCD don't necessarily matter because they can be very deceiving, right? So I don't know if you're working with a therapist, but I mean, I would have that open conversation with the therapist. Whether it's waiting out is a weird word, I would say keep doing what you're doing. Continue to challenge yourself. Sometimes we can reflect and look inward and ask ourselves, are we really fully surrendering to the process? And also understand that OCD's nature is to wax and wane and go up and down. I could be doing everything right, and because of a stressor in my life, good or bad, OCD can peak and get really loud again. And that could just be one of those cases. And to your point, I guess then, yeah, wait it out and just keep doing what you know to do, and understand that that's the behavior of OCD. And as long as you continue to not engage in compulsions as best you can, give yourself a lot of self-compassion, the loud OCD will start to go down to a whisper again. So, but I'm excited to hear that ERP has been really effective for the last 2 months. That's super exciting, and that's totally normal that it would sort of elevate again and sort of try and get loud and muster a comeback, and just got to put it back in its place. Try not to be too judgy with yourself about whether you're doing it right or not doing it enough. Have an open conversation if you're working with a therapist. But I'm really encouraged by that. I think that's awesome and totally normal. Syntax wrote, a tip for reducing repetitive behaviors rather than engage habitually and wait for a feeling to let you stop. Be aware before you start and focus completely on the first action. I'm going to reread that again, Syntax. A tip for reducing repeating behaviors rather than engage habitually and wait for a feeling to let you stop. Be aware before you start and focus completely on the first action. I don't disagree with that. I think that for a lot of individuals with OCD, having the room to notice that you're engaged in a behavior that's a compulsion is sometimes really hard, especially in the beginning. So, until you start to diffuse and get space away from your thought, right? So I think the goal is always to not engage in the compulsive behavior. I mean, that is always the goal, is to not engage in it, right? But for a lot of individuals, including myself, that started treatment or really was a few years into treatment, it was a while before I started to be able to realize, oh crap, I'm compulsing. It almost feels instantaneous. It's that fusion between thoughts and actions. And so totally agreed. But the goal is, while you're in treatment, the whole idea is to be exposed, and then try not to compulse, and sit with that discomfort. So hopefully that makes sense. um, but exposing yourself to that discomfort is necessary, to then be able to habituate to that discomfort and that anxiety. You also wrote, define a condition before you do the action. That would suffice, and then watch as that condition is met. Hi, Ethan. Thank you for all you do. Nice to know you are definitely not all alone. Welcome, Carol, and you are welcome. Leanne wrote, it's true love when you're thinking about the next life together. And there's Katie, my girlfriend, just back on, and don't know how we got to manatees, but it makes me happy. So, yep, there you go. Syntax wrote a for example, and I like to include, if you noticed yourself locking and relocking your door before you touch the doorknob, define in your mind a condition that would satisfy you, such as, I see the lock turn 90 degrees. So the problem with that, Syntax, is that, so that's a great point. But the problem with that is OCD is a doubting disorder. So even if you set conditions or parameters or infrastructure around it, I mean, there's people that take pictures, right? You start to doubt the condition. So, okay, I see the lock turn 90 degrees. Then you walk away, you get in your car and like, wait, did I see the lock turn 90 degrees? What if it wasn't 90 degrees? Did I really see it right? Which is why the true key to freedom from OCD is embracing uncertainty. Then it doesn't matter what you see. It doesn't matter, what you don't see. It's I'm pretty sure this is OCD. I'm fairly confident I locked the door. I don't have complete certainty. I'm not going to go check because I don't want to give in to my OCD. So I'm going to live with the discomfort that maybe my door is unlocked. Maybe somebody could come in and rob me or start a fire, or whatever the fear is. And I'm gonna sit with that because I'm pretty certain that this is OCD for all of these reasons. So defining parameters and conditions, OCD will doubt those, which is why at the end of the day, just willing to embrace the uncertainty, and it's not about willing to, you're not surrendering, or saying like, oh, I'm okay to feel miserable. It's short-term pain, long-term gain. What you're saying is, I'm willing to feel miserable in this moment in order to feel better later. And you do. So nobody's saying, habituate and feel anxious every day for the rest of your life. It's put in the work now to where you won't have to feel it later. But thank you for that insight. I appreciate it. Alex wrote, am I the only one who struggles more with compulsions in the morning right when I wake up? Great comment, Alex. I get a lot of anxiety in the morning. Sleep is a great way to hide, and it's a good thing. So in the morning, it's very common for a lot of individuals to struggle with anxiety, taking on the day. What do I have to do? What's asked of me? How much am I going to deal with? What do I have to deal with? All the questions. So that's I don't think you're the only one. And also, nighttime for me, nighttime was when I was really struggling. Nighttime was better for me, because I didn't have responsibilities. So I felt like, oh well, if I'm sick, it's okay. If I'm struggling, it's okay. And because of that, I didn't do as badly. But at the same time, a lot of people really struggle at night because they go to sleep. They're left with their thoughts. They're less distracted. And so nighttime can be really hard as well. But Alex, I definitely don't think you're alone in that. 7:20 p.m. cooking for Bay. I'm 30. My mother always points out that I don't directly touch items and tries her best to shame me for it. I also am diagnosed with TOCD. How do I explain to someone who couldn't care less? That's a great question. First of all, you're not alone. Um, in this. And I think lots of individuals with family member or friends, feel shamed and feel stigmatized. And, the first thing we can do, and you may have done this, I'm only speaking from this statement, but is to, try to address it compassionately. You can do this a number of ways. I would start with a YouTube video or a lot of the resources on the IOCDF page, or have them read an article. Hey, would you mind reading this article? The first thing is to, especially how they're conditioned, the first thing is to acknowledge that it's a disease and a disorder. You're not choosing to do this. This isn't a choice. This isn't something you enjoy. This isn't a decision. It's a disorder. It's a disease, right? So how do we get them to understand that? Well, maybe let's turn to a something professional, something that they would, respect a little bit more. And then from there, maybe sit down and watch a video clip or a keynote speech or something like that. I like to turn to things that are, professional but easy to read and don't seem that all that intrusive. And like, hey mom, it would really mean a lot if you would read this article. Just no, nothing attached. Just if you wouldn't mind reading it, I'd really appreciate it, and maybe we can have a conversation about it. And maybe you've tried that, and I have some suggestions from there as well. But that would be my first go-to. Uh, that's amazing. ERP through NOCD cut my OCD by almost 80%. Unbelievable. That's awesome. Um, Adam wrote, "Hi Ethan, I'm suffering from comorbid disorders that have very similar symptoms, OCD and eating disorder called orthorexia, and I'm constantly trying to decipher which one is which so I can treat it accordingly. To avoid this constant struggle with, manatee, could I use ERP for both? Thanks." So I don't. This is a great question, and as some foreshadowing, Adam, we have a bunch of eating disorder and specifically orthorexia content coming up. I think in March or April, we're doing a bunch of live streams on that. If you send me that in an email, I'm not personally comfortable answering that question only because I don't have a lot of experience with orthorexia and eating disorder, though I know how they relate to each other. But I think I would love to forward that to Chris Tronsden or Liz. We don't have an Ask the Experts tomorrow, but I think the following we could do, and that's a great question for them. But if you email that to me, I'll just forward that along and try to get you an answer pretty quickly. But that's a great question, and I would prefer if Liz or Chris would answer that for you. So hold on to that. You can also submit that on the Peace of Mind IOCDF IOCDF.com/peace of mind. You could submit questions. You can put where you want the question to go, and you'll have them answer it. But we can skip to the head of the line. You're here, so just shoot me an email. You can email me, by the way, and any of you can email me, by the way, at justethan@iocdf.org. That email goes directly to me. I'm the only one that sees them. I'm the only one that answers them. So please don't hesitate. I'll give my email out at the end as well, but don't hesitate. Thank you, Fran. So yes, that is scheduled in May for those eating disorder talks. So we'll definitely get you an answer quicker than that. But thank you, Adam. Appreciate you. No apologies whatsoever. Not necessary at all. Hi, Debbie. Hi, everyone. Glad this is a safe space to talk about OCD. I'm 60 and I've dealt with OCD since I was 13. Dealt with anyone young here. You were so lucky. Have good meds and good help. Debbie, I will tell you though, it's never too late. And I don't know if you're in treatment or in therapy or working on it, or maybe you found some relief. But one of our lead advocates is 64. I've met people in their 80s or 90s that are just finding treatment for the first time. There's a lot of beautiful life ahead. So I totally agree, and I think that's such a powerful message for people to hear, especially kiddos, or teens that feel like, I don't have to worry about it right now. I'm so young. It's like, I lost the first 30 years of my life to OCD. So I think that it's important for people to hear that, But hopefully you have not given up on yourself. So let us know how you're doing or how we can help. Let's see here. So sorry. Thank you so much for all these lives. Hey, Mike, it's good to see you. So Will asked about NOCD. Fran will put a link to NOCD. NOCD is it's an OCD community. They're also a virtual teletherapy based exposure response prevention platform. So you can access treatment and therapy through their app. They're a massive community as well. Website, Facebook, Instagram, all social media. The teletherapy is through app. It is with licensed, trained clinical professionals, all trained in exposure response prevention. They're overseen by a dear friend of the IOCDF, Dr. Patrick McGrath, who is a phenomenal clinician in his own right. And so essentially, you have a free 15-minute consultation. And if you're a fit, which most are, they'll pair you with a therapist in your state. So you're working with a licensed therapist in your state. You work virtually over the phone or a computer. I'm not 100% sure if it's 8 or 10 weeks. Rico probably has more insight into that, how many sessions and so forth. But I know they take some insurances depending on what you have, and also their out-of-pocket rate is cheaper than most therapists. So definitely check out NOCD, and you can download them in the App Store, Apple or Google Play. And I need to call them and let them know I said that so they can know it. They're amazing. Um, I was reading Leanne answer me only if you have time because I already asked a question. How do you manage OCD so it has less of an impact on the other people you live with or in your life? Boy, that's a big question. 727. That's a big question, Leanne. You know, I'll just make it quick. It comes down to treatment, and treatment and therapy and proactiveness and doing homework and all that stuff. And the more you engage in exposure response prevention, acceptance commitment therapy, and a lot of other really cool modalities of treatment, you kind of have to put on your oxygen mask first, right? And the more you help yourself, the more that helps others. It's definitely a family disorder. It definitely impacts people that you live with, and so or the people that you're around. So the impact really comes down to how you engage in treatment and how you address it. And if you're doing it on your own, there are definitely ways you can. And I'll give out my email again, Leanne. I'd love to touch base with you and maybe give you some insights on that. But the short answer is therapy, and that's the short answer is treatment. Whether you're reading a book, Freedom of OCD, whether you're engaging in apps, whether you're following Instagram accounts, which is not a replacement for therapy, but there are great Instagram accounts with great insight on self-compassion and meditation and insights and all kinds of great things. So there really are amazing tools to access through books and online and so forth and so on. And yeah, you have to work hard and dig definitely to access treatment. And there's waiting lists, and I think we just talked about this on a town hall last week. And listen, from my heart to yours, my goal, if we can just make a small dent in making treatment, effective, affordable, and accessible for everyone. It should not, money should not be a barrier to treatment. It should not, as Liz McInville always says, we should not be the exception. We should be the norm. She says something like that. I'm not sure that's it. But the bottom line is everybody should have access to treatment. And that's what we're working hard to do here. So, but yeah, essentially engage in treatment, and it doesn't have to, be a part of your life. You don't have to live for it. And Allison, hi Debbie, I'm 55, so it's wonderful to see you how far the understanding of OCD has come. There you go. And Mike says it also helps for family members to speak with other sufferers. Absolutely, Mike. Totally agree. The question above about helping people understand, which is why I like some of the videos. If you can pull up other sufferers' keynote addresses or other speeches or even a TED talk, something like that. Michael Hoffman at 7:28 p.m. asked, my 14-year-old son was diagnosed with OCD last spring, so we're early on his journey. I'd love to understand how helpful meds were in doing everyone's ERP work and ultimately quieting the OCD thoughts. We know it's a marathon. I love that it's a marathon. Oh, Michelle. I think I said Michael. Sorry about that, Michelle. So we generally don't talk a whole lot about a medication on this particular program just because we don't have a psychiatrist. But what I will say is, science has shown, research has shown that combination of medication and therapy can be most effective. That doesn't mean that medication is best for everyone. I know lots of people who have never taken medication who have thrived really, really well. I know lots of people who have taken medication and engaged in treatment and therapy and done really, really well. And I know a few people who are just on medication. For me, I'm on medication. I talk about it all the time. What I can say is what it tends to do in cases is it tends to sort of ease the obsessions and the compulsions and open up a little bit bigger window for then ERP and therapy to get in there and work. Whether that's something in your case for your son, that would be up to your clinician, your team, your psychiatrist, and a joint decision with the team. But with that being said, everyone has their own unique experience with medication. That's why I don't like to talk about specific kinds of medications, what I'm on, what somebody else is on. Everybody has their own experience. One medication can be great for somebody and not great for another person. So I don't like to get into details, but medication along with OCD, along with treatment, can be very effective. Just comes down to what your experts in your corner believe is best for your son. But yeah, it does open up creates a little bit more room for treatment to get in there. I know it did for me. That was a weird noise. Jeffrey wrote, my OCD gets really bad at night. It is interesting to hear about people who get bad anxiety in the morning. My thoughts keep me up. As I said, yeah, it can go either way. For me, I was a morning. It really bothered me in the morning. For a lot of people, night. And I think probably because you're out of routine, you're done with the day, and you're left sort of with your thoughts in bed. And that can be really scary for sure. Dave Dowdy, hey David, hi Debbie. I am 16. I've dealt with it since I was 9 or 10. Yeah, you are not alone, Debbie, for sure. Betty wrote, Ethan, thanks. I've been on med since 1993 and therapy for years and doing quite well. Still struggle with agoraphobia and traveling with the thoughts, but I've come a long, long way. Thank God. Praying for the same, all of you. That's awesome. Oh, your update. I love that. Thank you for sharing that, Debbie. That's awesome. And you know what? With COVID, it's made it a little bit trickier for some of us with OCD to sort of get out and do things, but we do the best we can, and I love hearing that. So help and hope. Um, she's a perfect example, and that's awesome that you found help in 1993. I was diagnosed in 94 and put on medication, and then didn't find ERP till I was 31 in 2010, even though I went to the best therapist for 17 years. So yeah, I don't know. It's just everybody has, it's weird, but I'm so glad you're having a good life, and that's awesome. So thank you for sharing that. Um, Micro ERP, micro the bet here. You can post this, friend. I love this. 7:32 p.m. The best thing I have found is making ERP a lifestyle. Absolutely. Um, sorry, I'm distracted because I got a little Charlie horse in my foot. It's hard to talk at the same time. It hurts so bad. Yes. ERP never goes away, and what I mean by that is, what I mean by that is that you may not actively seek out exposures like you do in treatment and therapy once you re-engage in life, sort of in maintenance or management. But the idea is to always be willing to do something that's uncomfortable, if it's toward your values. I always use the ranch dressing analogy. I open up the fridge, I swear to God, every time. I can't remember when I bought the ranch. I don't know if it's gone bad. What if it makes me sick? And I eat the ranch every time. That's an ERP, and it's a lifestyle. Also, ranch dressing is a lifestyle. For more information on foods that ranch dressing goes for, email me at justethan@iocdf.org, and we can talk about ranch dressing. I may do an entire community conversation on ranch dressing, because I'm a huge fan of ranch, and so just saying. Um, Allison, if you still feel like it, can you please share your tough weekend? I've had a few. Oh, for sure. Thank you. And I'll try to get to more questions afterwards for sure. So I'll try to keep this fairly short, which I'm not good at, but I will definitely try. 2 weekends ago, well, let's backtrack. The week before 2 weekends ago, I started having some chest pain, and I'd had it before, and I didn't think it was heart related. I have health anxiety. It's pretty much put to bed and not something that I deal with regularly, but occasionally when things go up, I definitely get spiked and triggered. And I noticed it very strongly in a couple of days, and I really wanted to, reach out and find out what it was. I met with my therapist on Tuesday. We talked about it, and we made a plan. Which was essentially, I had an appointment in April. We were going to wait till that. As the week went on, it got worse, and I started to panic a little bit about, what is it, and am I doing the right thing? And I decided this with my therapist, but I feel like I should go to the doctor and get it checked out. And let me preface by saying that I'm not advocating that if you have a chest pain you shouldn't go to a doctor. Everybody's, I'm talking about my own personal experience based on my entire history of dealing with health anxiety and OCD, and also being with this therapist for 11 years, so she knows me very, very well. And so just I'm not, so keep that in mind. This is in context of my own journey. But long story short is, I Thursday, I decided to go see the doctor. I didn't think it was a cardiac issue. Every part of me wanted to go to the ER, not because I was afraid I was having a heart attack, but I just wanted answers. I wanted to know. I was at that point where I'd waited 4 days, and now I was like, okay, I want to know what this is. I want to make sure it's okay. I want to know all the answers. I need that instant gratification. Like, give me that hit. I need to know. I called the doctor, but I didn't. And I called my regular doctor on Thursday, and his first available was Monday. And I said fine, because I knew that if I tried to push and get in earlier, my therapist would. So I will tell you, soon as the weekend hit and work was over and I didn't have, many distractions, it hit me hard. I don't know. how much of it was OCD, how much of it was health anxiety. I don't really care, quite honestly. All I know is like I was so freaked out about what it could be. I didn't like that I had to wait until Monday. I wanted to go to the ER, even though I knew it wasn't an emergency. And I didn't go to the ER, but I did sleep. I slept a ridiculous amount that weekend. I mean, I really checked out, um, and really disengaged in life and just kind of wanted to disappear and not think. And I haven't had a weekend like that in a really long time. And so, I mean, avoidance is a compulsion, right? So if we consider avoidance a compulsion, which it is, I was avoiding my feelings. I had forgotten all my skills and tools. I was not doing any of the things that I typically tell people to do. Um, and by Sunday night, I was kind of like, all right, that's enough. I need to get up and do some stuff, and did some baby things. Went for a tiny walk, made some dinner, and then went to the doctor on Monday. But yeah, I just, I was just I don't know why. I had that feeling a few times before in my chest, and I got panicked. I went down a rabbit hole of catastrophizing and all the horrible things that can happen, and that was it. I started Googling ridiculous amounts. That is a compulsion, obviously. All the different kinds of chest pain and what's it mean, and trying to look for justifications why I should or shouldn't go, immediately to a hospital. And of course, you go online and, your toenail hurts and, you're 30 seconds away from death. Um, anyway, but I went to the doctor and, he gave me some thoughts. I got a chest x-ray and, everything's fine, nothing serious. And of course, my OCD latches onto that, right? Uh-oh, well, are you sure it's nothing serious? But I bounced back pretty quick, and that's really what it's about, is that I could be compassionate that I had a rough weekend. I can be compassionate with myself that I didn't necessarily make the best choices for myself, whether it's OCD or anxiety or health anxiety or whatever it is. It's all mixed in, it's all part of the soup. I can have compassion with myself that I'm a human being, and I make mistakes. um, and then where do I go from here? And well, I can only control what I can do in the future, right? So it was about, all right, what do I need to do moving forward? I need to, not beat myself up and get back on the horse and continue working and doing and things like that. And that's what I did. What's interesting is this last weekend I was actually kind of down, after having a really good week and feeling up. And however, I really tried not to, let it interfere with my functioning, and tried to do really value driven decisions. Been eating healthier, been working out or walking. So it's been a little bit up and down for me, the past 2 or so weeks. But I learned some lessons from a couple weeks ago and tried to apply those lessons this last weekend. And Monday, I know I'm talking too long. Sorry. Monday. Wait a minute. It's my live stream. I can talk as much as I. No, I'm kidding. I'll tell you. Yesterday, like I woke up, I was crazy anxious. Didn't feel like working. Um, really just wanted to throw the covers over my head, and really just engaged in, in what's called opposite action, which is just, you ignore how you feel. Ignore isn't the right word. You embrace how you feel. It doesn't feel good, but you do it anyway because it's important to you, and bring your feelings along with you. Sort of like when you go to the gym. You don't feel like going to the gym, but the exercise is healthy and you're moving towards something that you care about. And so, and over time, I felt a little better. And today was a much better day than yesterday. And I'm sure tomorrow will be better than today. So that's my story. I think it's really important for as many advocates as possible that are, especially like, on a national platform or talking. I always feel weird saying that because I'm not referring to myself as, but I always think it's important for individuals that talk a lot about OCD that are public to also share, times they're struggling, almost like social media. Like, we can't just show the good times, right? So, I mean, I definitely talk about times where I struggle, ups and downs, and stuff like that. But I always want to share, when I've had a hard time, because it holds me accountable, and you hold me accountable. And I think it's important, to know that you're not in it alone. We're all in it together, and but I'll say this, and I said this to Katie, my girlfriend. I said this to my parents. I will take this weekend. I will take a weekend or 2 weekends like that a year for the rest of my life over the life that I had before. And we can argue all day about OCD being chronic or OCD being a cure. Is there a cure? Is there not a cure? We can have that discussion. But if this is what chronic looks like, I'll take it. I'll take it because my life is beautiful. and I want everybody's life to be beautiful. And while there's no cure right now, if I have 4 days a year that looks like that, then as far as I'm concerned, that's a huge win. So, um, Alex wrote, personally, for me, the combination of everything and getting a proper diagnosis has been a huge help. For me, I found a clinic through a university that specializes in OCD and anxiety disorders, diagnosed last summer. Also, educating myself through IOCDF has been super helpful as well. I have my good days and bad days. Like you said, it's a marathon, but there is hope. Awesome, Alex. I love that. Jeffrey wrote, what are your tips for staying consistent with therapy? I get started on ERP and then give up due to my anxiety. For sure. My first tip, and Grayson says this really well. I've referred to Dr. Grayson a couple times in this stream. Freedom from OCD. If we haven't posted the link already, we should. Great book. What are the compulsions taking away from you? What are they robbing you from? What is choosing OCD over your values taking away from your life? And I've said this before, and I apologize if I'm repeating this for people that have heard it already. For me, the reason I try to stay as consistent as possible, whether it's in therapy or just in managing OCD through life, is to really think about if I'm choosing OCD, what am I not choosing? Am I not choosing to go on a meeting that day, which is really important toward my career? Am I choosing not spend quality time with the person that I love? Am I choosing, what am I losing? It was so key when I was really sick to understand every time I was choosing OCD that I was not choosing something meaningful. And when I made that real specific, so instead of going thinking to myself, oh, I compulse, it's like, no, you're saying no to meeting a girl that your person. You're saying no to, at the time, becoming an actor. You're saying no to going out tomorrow and getting a job. You're saying no to your values. You're saying no to your goals. You're saying no to the things that you love and care about, right? And so understanding why you're choosing therapy, why you're choosing ERP, why you're choosing to live with that anxiety initially. Why are you choosing that, Jeff? I'm going to call you Jeff. We're buds now. But why are you choosing that? Why is it important to you? You have your reasons. Everybody here has a reason for why they want to get better. What are their values? What are their goals? Keeping that in the forefront and understanding that you can't have OCD and those values and goals at the same time. It's one or the other. So what are you going to choose? We're human beings, just like a diet. We mess up. I had a bad weekend. You could compulse. It's an up and down, but it's always, 3 steps forward, 2 steps back. That's always the goal. And you may have more steps back than forward, but the goal is systematic gains, right? That's the best tip I could possibly give you, is what are you losing? What are you heading away from that's important to you? And how willing are you to give up what you love and choose the anxiety and the OCD instead? And you'd be amazed at how much tolerance you have for the discomfort. And understand that there is an end game, meaning that the goal isn't to feel the anxiety forever. The goal isn't to have to fight this hard forever. The goal isn't to engage. It's to engage in life in a meaningful, present way, to experience a full life, whether that's joy or sorrow, whatever it is, right? And so, also keeping that in mind, that this is a means to a full life as well. Senorita asked, does keeping myself busy help with OCD? Well, sure. Routine is really important. Busyness is really important. We can get into the weeds a little bit with purposely staying busy can become a compulsion. But, I will tell you that one of the primary ways to get better from OCD is establishing a healthy routine. What does that look like? And getting in a set routine. An idle mind is the devil's playground for OCD. And so a lot of people really thrive in a more structured environment. And it's, I guess, in a microcosm, it's similar to what we're talking about people struggling at night more with their OCD, right? Like the routines are over, the day's over. You may have to get up, cook breakfast for the kids, get them out the door to school, go to work, take a break. So your OCD really doesn't have sometimes a lot of room to create havoc. And for most people, sometimes it does and really knocks you out, right? But as you start to get better, the goal in life is to not, the goal in treatment is not to stay in treatment. The goal in treatment is to become your own therapist so you can engage in life. And so what does engaging in life look like? And, routine and structure and value driven decisions. And, even if you're not working, get up, shower at the same time, brush your teeth at the same time, get dressed at the same time, take a walk at the same time, set an hour to call a friend, read a book. We can all set different goals for ourselves depending on where we are and sort of create a necessary routine, and then that routine can grow. Hi Grace, it's good to see you. I love your comment. Thank you for that. I hope everybody reads Grace's comment. Um, let's see, I'm just going to quickly keep scrolling down here. Will wrote, Ethan, so an OCD support group professional had me touch bottom of shoe, then touch my face, which I have no problem with, but she said urge of washing hands is okay. Well, I don't know if you're asking me, Will, I don't want to give you reassurance, but I would tell you that, that sounds like, an exposure, right? Lots of times, and I don't even have contamination OCD, but just in case I did, my therapist had me touch all kinds of things and then, open up a sandwich and play with my meat and then eat it. And so, that is definitely not out of the realm of possibility. I can't speak to whether you were seeing an OCD therapist or not, but what I can say is, that portion is an exposure, and but I'm not going to tell you whether it's okay or not. We'll have to live with that discomfort, but I can tell you that, it's all about doing uncomfortable things and then learning how to cope with that anxiety that isn't compulsing. So, um, let's see here. Let me see if there's any other questions from those that haven't asked. Grace, how can you tell if you need a higher level of treatment for OCD, IOP, PHP, or residential? Great question. This is a great question. So, you want to look at your functionality. How much is OCD impairing your functionality? I mean, truthfully, the goal is to stay involved in life. Um, that's really important. So, what does that mean? You don't want to stay engaged in life, sort of what we call white knuckling, where you're just not present and you're showing up, but you're deteriorating. But if we can keep you, I always say we, like I'm a therapist. I have 3 months of college. I'm not a therapist. Incidentally, I dropped out because of OCD. So, I think that the first place to look at is once or twice a week enough for you to do what you need to do. If you are struggling with engaging in the magic of therapy doesn't happen in the therapist's office. It happens outside of the therapist's office doing what you're doing. If you're struggling to engage in ERPs and other modalities of treatment that therapist is asking you to do, that's when you want to look at a higher level of care. You may need more support, which is totally okay and totally normal. Depending on where your OCD is at. So maybe you enroll in an intensive outpatient, or you enroll in partial hospitalization, or you create your own, and maybe you go to your therapist 3 times a week or 4 times a week for an hour, or so forth and so on. But ultimately, do you need more support for ERP and engaging in treatment? Also, how much is your functioning decreasing? If you're at a place like where I was, where you're not able to work, I wasn't feeding myself, and you're really dysfunctional, then something like intensive and residential, are really necessary and important. It can really help you, turn the page and that 24-hour care. Residential programs for OCD are not lockdown facilities. They're not, you don't get put away there. It's, it's 24/7 care and support, but it's a lot like going to a really weird college, where you room with people and you're in group settings and you have therapy every day and you do ERP every day, and it's really about, as we talked about, creating routine and creating structure in a monitored environment where you can get the support and help you need to not only engage in ERP but not compulse. And then you take those tools back with you and really thrive. So yeah, I mean, I think it's a personal decision, and if anybody has any questions or want to kind of sort out what's best, feel free to email me. But that's the quick answer, Grace. Thank you for that. 4 more minutes. Let's see if we can get a few more questions in. I know I talked about myself. It wasn't my idea. Somebody else asked me to do it. It's not my fault. Support groups, perfect. I love this. Mike is full of wisdom today. Ethan, 7:43 p.m. Self-compassion is so important. We have to love ourselves even when we have a difficult time. We cannot be perfectionistic with treatment. Proud of you. Thank you, Mike. That's such great insight from Mike Sizemore, who's bringing the insight. Irfan wrote at 7:43, Reddit is the worst website for people with anxiety and OCD, for sure. Back in the olden days, it was all the Yahoo answer threads, if you remember those. Yeah, it's awful. It's absolutely awful. And David wrote, I've been down the rabbit hole. If I think about David, there were various times in my life, starting in my teens, where I was worried about my heart and chest pain and things like that. So there's definitely precedence for it, So we've got 3 minutes left. I want to see if I can see any last questions quickly. I see your question, Summer. Email me that question, Summer, about random medication, because like I said, I don't typically talk about it, medication, but I'm happy to answer that question. Irfan, do you think OCD is worse during winter? Seasonal effectiveness disorder is a real thing. So I think winter, depending on where you live, lack of sunshine, I definitely think that mood changes in wintertime, and the time change, of course. So for a lot of people, I know for me, when I was really struggling, typically I had, you could sort of track it, summer and spring were typically good months for me, or better months, I should say. And I really struggled fall into winter. There was always a significant increase in symptoms for me. Oh, yep, Leanne wrote, I have seasonal affective disorder too. Thank you, Leanne. Appreciate that. And one more, Mike. Let's end on one more Mike Sizemore truism. 7:46 p.m. Gratitude is a fantastic medicine. Love that. And there, Heather said it beautifully at 7:48 p.m. When you say yes to OCD, what are you saying no to? That's exactly right, and much more eloquent and concise than what I said. All right. We are nearing the end of the hour. I have some housekeeping. So first of all, as always, I want to thank Fran behind the scenes for keeping the lights on. Let me know if I should keep that end line, keeping the lights on. Before it was digital voodoo. We do need something new. Please feel free to let me know if you hate that, and I'll try to come up with something a little more entertaining. But most importantly, thank you for being here, and thank you for your engagement and your questions and your advocacy. I mean, this is such amazing advocacy. I mean, I know that you feel like you're here to get support, but you have to understand how much you're supporting one another, and just the comments back and forth, and the thoughts and the insight and everything. Everyone in this room or in this live stream is really just doing such amazing work and gifts by helping one another and supporting one another. So thank you for being here. Thank you for your advocacy, to all of us. I really appreciate it. So like I said, I want to thank the IOCDF and Fran. So this live stream is one of many. You can view entire live stream schedule and submit topics and questions for future live streams by visiting IOCDF's Peace of Mind virtual community at iocdf.org/peace of mind. On that note, tomorrow at 12 p.m. Eastern, we have our research roundtable. They'll be talking habituation therapy, inhibitory learning, and ACT. That's tomorrow at 12 p.m. with Kyle King, Dr. John Abramowitz, and special guests. And this is all about research and information from a lay perspective, so we can actually understand what they're talking about. I hope that's what it's about. That's what I've heard it's about. I should probably watch tomorrow. But tomorrow at 12 p.m. Eastern, habituation therapy, inhibitory learning, and ACT. Also, you can check out the whole calendar at iocdf.org, Peace of Mind. You can view all the live streams and what's going on and the topics for all the upcoming months as well. Remember to like and subscribe on Facebook and YouTube as well. Yep, there we go. Okay. Oh, I've never done the pick the nose thing. All right, Twitch. There we are. Nope. All right. As always, if you need resources, please visit iocdf.org. Amazing resources on there. And also, as always, during the stream, I do give out my email. If you have additional questions, comments, if you want to talk topics, don't hesitate to email me at justethan@iocdf.org. Give me a few days. I will get back to you, though. But I do answer those personally. And so anything that we didn't get to today, feel free to ask me there. Feel free to wait till next week for all the Ask the Experts and town halls and things like that. And always, if you want to email the IOCDF, you can also email the IOCDF at info@iocdf.org. OCDF.org. With all of that, thank you so much for joining tonight. This has been a lot of fun. I love these community conversations. I'll be back 2 weeks from tonight. So until then, stay safe, stay vigilant, feel the feels. Don't let OCD off the hook. And we'll see you in a few weeks. Have a good night. Bye-bye.